It is time now for a Medical Monday segment with Advent Health. And I love the different issues that we dive into on a weekly basis. And this morning is one that I know a lot of people are dealing with, certainly when it comes to muscles, bones, joints. Dr. Baker joining us this morning to talk more about that again with bones. I know your specialty is really shoulders, which I'm eager to chat with you. But good morning, doctor. Glad to have you here.
Good morning, Carly. Thank you for having me.
So let's first address, I think when it does come to bones, osteoporosis comes to mind, right? I think a lot of people see the commercials about it. I think a lot of people know loved ones, if you're not yourself, that if, this is an issue that tends to come up. What say you that we need to know about osteoporosis?
Well, what's interesting about osteoporosis is it's pretty pervasive in our society. Both men and women get this. It's not really much of an issue until there's a fracture, though. So until you have a fracture or an injury that causes you to seek medical treatment, that's usually where your first diagnosis comes in. When we look at osteoporosis and fractures, what it does is it increases the risk of a fracture in a fall because your bone is basically softer and it's just not quite as strong and resilient. And it tends to affect women a lot more than men, up to 4 times more common in women than it is in men. If you look at women as we get over the age of 50 or so, there's about a 1 in 2 chance that that person is going to sustain a fracture at some point in their life related to osteoporosis.
1 in 2, wow.
Yeah.
So your specialty, you're a surgeon. You were telling me before we got started, shoulders. I would imagine that has got to be one of the most common places where people are suffering and having pain. I was telling you about my mother-in-law that it's kind of hard to pinpoint what it is that's causing pain.
Yeah, that's the hardest part of the shoulder in general. And actually, in my situation, I did an extra year of training just to kind of hone in my skills on diagnosing and treating shoulder problems. And the difficulty on the shoulder is that it's kind of between the arm and the neck. And a lot of those pains and issues can kind of radiate one direction or the other. So we get a lot of folks that come to us with arm pain, even though it's really coming from their shoulder. Other folks will come to us with neck issues that are radiating down to their shoulder. So it can go both directions and be a little bit difficult to diagnose.
So what do I want to talk about prevention, if there's anything certainly that women can do today watching, any form of preventative, I think is key. But then how do you know what route to go? I mean, obviously you're a surgeon, but that's not always the first, thing that top of mind that people want to do. So let's start about preventative and then talk about treatment.
Yeah, so when it comes to the shoulder, interestingly, if we're talking specifically about the shoulder, most of what we do as surgeons is diagnose and treat non-operatively. And, if I see, let's say, 10 patients in a day, which is vastly lower than the actual number I see, I would say less than one of them is going to get any intervention from me. Most of the time, I would say 90+% of the time, patients that we see are treated with anti-inflammatories and physical therapies and kind of changing the ergonomics of what they do on a day-to-day basis. So most of the time, we're not talking about surgery. When we talk about pain related to the shoulder, first and foremost is an injury. So getting back to that osteoporosis thought, if you've had an injury to the shoulder and you fell off of a step or out of a vehicle or whatever it may be, a fracture comes into my mind. And so that's where we start to worry about those osteoporosis issues. When you have someone that just wakes up with pain, it's really more about their physical exam. If they have a physical exam that has full motion, they're able to reach above their head and use their arm. Most of the time we're dealing with a tendinitis. Whereas if they have limited motion but no injury, usually we're dealing with more of a stiffness problem, which is something called adhesive capsulitis or a frozen shoulder.
When should someone actually call you? Because I think sometimes we just assume that this may be a normal part of aging. It's something that we're just going to have to live with, that pain, of just kind of aging. I would imagine that you say if you can get better quality of life, don't wait to call.
Yeah, it's interesting. I have a thing that I like to tell my patients is that, pain is not a normal part of aging. And I would say, almost every single patient I see in a day sees me because they have pain. And folks who get into their 50s and 60s and then beyond basically will push off whatever it is for weeks and months and sometimes years because they say, oh, I'm just getting old. And that's why I have a job, is to get those patients out of pain. There's plenty of old people out there that are very active, that run and exercise and lift and do CrossFit. So if there's pain, then something is wrong. So, beyond the obvious things, you broke something, it's dislocated or it's bleeding, those need to go to the ER, obviously, you know that. Anything that, to me, disrupts your sleep. So if you're consistently not able to sleep as a result of the pain, and for me, that's usually what pushes the patient to come see me, is that the patient can't sleep or their spouse can't sleep. So if they are waking up their spouse because they're tossing and turning and hurting, that's one reason to go see your doctor. Another reason is basically if you can't keep up with your friends. So, if you are saying, look, I can't go on that trip, I can't go do that exercise class, those are other reasons I think to come see me. And then lastly, if you can't do your job, I'm having to have so-and-so lift up this thing at work. I see a lot of flight attendants that come to me because they can no longer do overhead baggage checks and those types of things. So if you're limited in your sleep, limited in your activities and exercise and just enjoying life, and limited in your activities at work, all of those warrant being seen by a doctor for sure.
Well, doctor, we really do appreciate your time this morning. We've been showing the website, floridaorthoexperts.com. I'd imagine that's kind of the first place to start if people want to find out more information, doctor.
Absolutely. Absolutely.
All right. Well, we again appreciate it. Thank you so much. We look forward to hopefully seeing you again soon, doctor.
Great. Thanks so much for having me.